From 7 News, this is a Call 7 Investigators special presentation.
Continental 1404, wind 270 at 27, runway 34 right, clear for takeoff.
Heading 020, clear for takeoff, runway 34 right, Continental 1404.
115 people expecting a 2-hour flight to Houston.
We have a report of the 737 down on 34 right. Yes, we have a plane crash on 34 right.
It was a significant firefight.
For everybody to walk off of that plane, essentially, is just amazing.
We've got a full response going there.
It was surreal. There's this big fireball out the window.
It's going to be a 737, confirming flames and smoke.
A night demanding critical decisions.
When you have a fire and smoke in a plane crash, that length of time is a problem.
Code 9 to DIA.
Why would you take that long?
Because you don't have enough ambulances to cover the city and to cover DIA.
Sometimes in Denver, you'd be a lot better off driving yourself to the hospital.
How many ambulances do I have coming out this way?
28 minutes would not be something that I would be proud of.
A plane crash, testing the core of Denver's emergency system.
If you're having trouble with ambulances, I could take a couple extras to send this way.
Denver knew from the day they dug that airport the proximity of ambulances and the challenges associated with getting ambulances there.
If I was in that city, I would ask for an investigation.
Tonight, a special Call 7 investigation, breaking down Denver's ambulance response to the crash of Flight 1404. What happened? Why it happened? And will it be fixed?
It's unacceptable. You can't have an ambulance there in 33 minutes, and that will never happen again.
33 minutes to 34 right. Denver's broken ambulance system. From Denver International Airport, here now is Tony Kowaleski.
When this Continental 737 crashed here at DIA 3 months ago, the flight crew and firefighters reacted immediately. Within minutes, the plane was evacuated, the fire was out. Not a single life was lost. The crash provided the perfect test of Denver's emergency response system, a real-life exercise for firefighters, ambulances, and hospitals. An exercise that exposed a critical failure, a breakdown that centered 26 miles from here at Denver Health Medical Center.
737's down on one of the runways, flames and smoke.
Firefighters, paramedics, and emergency responders spent thousands of hours preparing and training for this exact moment. Did Denver Health pass the test?
I would have to say no.
Bob Petrie has spent 2 decades as a Denver paramedic.
I'm very troubled about the transport ambulance response, especially how long it took to assign those units and how long it took to get them to the airport.
I've got a report of a crash on 34 right, unknown aircraft, unknown type.
Continental Flight 1404 crashed at 6:18 p.m. The next 12 minutes provide a stark contrast in emergency responses. From the airport, 7 specially equipped fire rigs and 25 firefighters were on the runway within seconds of the first call. And in less than 5 minutes,
32s, 29s, 27s, squirt 10, engine 6, truck 2, decon, hammer, rescue, and T5.
Denver Fire sent backup from every corner of the city, 10 additional units.
When a red alert comes in, it's an automatic response. We'd rather have it there than have to call it in.
I knew it was real the minute we got the call.
These exclusive pictures show the challenge Assistant Fire Chief Bill Davis and his crew faced on that Saturday night.
It was dark, and the only light, as your pictures show, was the light of the fire on the airplane.
They surrounded Flight 1404.
It was a real firefight, one of the rare firefights with an occupied airplane. The guys just drove that equipment straight into that fire and put the fire out.
17 trucks loaded with firefighters raced to the crash in less than 5 minutes. Now compare that to the ambulance response from Denver Health. 5 minutes after the crash, not a single ambulance has been dispatched to the airport, even though inside Denver's emergency call center, fire and ambulance dispatchers sit in the very same room, less than 30 feet apart.
Denver 911, where's your emergency?
And Denver Health's own records show at 6:23 p.m., a full 5 minutes after the crash, Denver EMS dispatchers have not yet been notified. Then came the first confirmed call to EMS.
We had a red alert crash.
Okay, on where?
Runway 34 right. It's going to be a 737, confirming flames and smoke.
Seconds later, a 911 call from one of the plane's passengers, Valdir Alves.
I said something to her that we have a crash, aircraft crash in the Denver airport.
Despite confirmation from the airport and a passenger, Valdir's call is given the lowest priority. Take a look. It's listed as non-emergency, monitor only.
I believe when somebody says a plane crash, you don't have to say anything more.
So emergency calls are coming in. Airport firefighters are already at the crash scene, and injured passengers are walking up the hill to this fire station about 100 yards from the crash.
Denver 911.
In the ambulance call center, dispatchers know a 737 has crashed, there were people on board, the plane was on fire. And still, no ambulance is on the way to the airport.
We need those ambulances coming to that airport the second we know that there is an airliner down, because we can't recover that time.
It was 6:27 p.m. when dispatchers sent that first ambulance. The ambulance was 19 miles from the airport on I-70 and Colorado Boulevard.
Code 9 to DIA Gate 1, please. We don't have a patient just yet. Probably have an incident going on. Code 9 to DIA.
And here's a critical point. That first ambulance was sent Code 9, a non-emergency. That means no lights, no sirens, and no high speed.
No reason that I can conceive of that a response to a confirmed crashed commercial airliner, that the initial response would be non-emergency for transport ambulances. It's unbelievable.
Bob Petrie is not the only expert questioning this delayed response by Denver Health.
There's a true lack of coordination, a true lack of preparation.
Those patients had a right to expect more, and I don't think they got it.
7 News asked 2 nationally recognized experts to review and analyze Denver's emergency response.
When you look at a plane crash or any type of disaster, the first few minutes are critical to saving lives.
Jim Sedaris has spent more than 25 years working in emergency services.
There was a true failure in this system.
Jeff Lindsay is assistant professor of emergency health services at George Washington University. He spent nearly 20 years in the field as a paramedic and a fire chief.
At least in everything that I've seen and read, it's a broken system.
A broken system that took 12 minutes to order the first ambulance with full lights and sirens to a plane crash.
21 code 10. Confirm, please.
12 minutes filled with indecision. 12 minutes lacking urgency and direction, foreshadowing more failures in that first critical hour.
Let us know what's going on.
33 minutes to 3-4 right. Denver's broken ambulance system. A special Call 7 investigation from Denver International Airport. Once again, here's Tony Kowaleski.
So here's where we are on the timeline. It's now 12 minutes after the crash. The fire is out, and injured passengers are making their way to the fire station. It's now 6:30, and the closest ambulance is still 10 miles away.
What you don't see, Tony, is the people. There were 100 and something odd people that were migrating. They were right in this immediate vicinity.
Assistant Fire Chief Bill Davis was directing the emergency response. His crew was now inside the fuselage searching for potential victims. Inside the fire station, the frustration was building for some passengers. This incident report obtained by 7 News shows at 6:30, dispatchers were told lots of injuries and unknown if everyone got out. At 6:31, a passenger called Denver's dispatch center. Notes from the call read, victims are in fire station on top of hill near crash with people that are injured. Sees no help. In the call center, Denver Health dispatchers have been on the phone looking for available ambulances from private companies.
I just need a number because there's a plane that crashed at DIA.
I've got 4 ALS available.
4 ALS.
Yep.
All right. I'll let you know.
4 advanced life support ambulances available but still not sent, and more indecision from the lieutenant in charge at the dispatch center and a paramedic captain on his way to the crash.
And I've already checked on all my privates, and I've got them ready too. You want me to start moving them?
Well, no, that's good.
In fact, 7 News has learned that dispatchers had confirmed at least 12 available ambulances from private companies, but none were immediately sent to DIA. Another critical point, at this time there has been no call for medical helicopters, no request to respond or stand by. At 6:35, 17 minutes after the crash, nearly 40 injured passengers are waiting on the one ambulance that has been sent to help. Is that what the public should expect?
No, they should expect a much better response than that. And they certainly should expect more than one ambulance.
Now fast forward 10 minutes. It's 6:45, 28 minutes after the crash, and the first ambulance just arrived here at Gate 1, the gate to the airport runways.
Essentially, it's too long.
When I saw 28 minutes, it had to make you wonder what's taking so long to get an ambulance there.
Emergency response experts Jim Sedaris and Jeff Lindsay.
It's unacceptable for an EMS service or any emergency service to be delayed for a 28-minute period.
And when you're looking at 28 minutes to get one ambulance on site, when you have 30 to 40 patients, just doesn't meet the national standard.
And the delay didn't stop there. Records show the first ambulance waited for an airport escort at this gate for another 3 minutes. The drive from Gate 1 to the crash site, another 2 minutes. In all, 33 minutes to get to runway 34 right.
What do you estimate on resources out there? Not sick yet. I've just heard 4 confirmed patients, but we got a whole plane load to triage.
More than 100 patients to triage, survivors of a plane crash, waiting 33 minutes for one ambulance at the 4th busiest airport in the country.
How many ambulances do I have coming out this way? Right now, sir, you have a total of 10 ALS cars. 10 ALS cars. Code 10 to your location at this time.
While the urgency of the situation is picking up and more ambulances are on the way, the 2 available helicopters are never called in. Sources with the NTSB, Denver Fire, and DIA call that a critical mistake. Meanwhile, passengers waited another 7 minutes for the second ambulance to arrive. 7 News analyzed all the ambulance responses from that night. Here's what we found. 40 minutes after the crash, 3 ambulances were at the airport. 50 minutes after the crash, it was 5 ambulances. And it took a full hour before 10 ambulances arrived at DIA. Our analysis also showed responding ambulances needed, on average, 17 minutes from the moment they were dispatched until they arrived at the airport. That's nearly double the national standard. Paramedic dispatchers were reluctant to send ambulances. Why?
I believe because they're trying to conserve the resources they have, which are inadequate to do the job. Experts
tell 7 News the solution has to come from the executive offices of Denver Health.
It's something they need to question themselves to say, you know what, we dodged a bullet on this one. It's not the medics on the street, it's not the supervisors in those rigs, because they only have so many resources available to them. It has to be at the senior level of that organization.
It's an organization that admits in this email to 7 News that the Paramedic Dispatch Center does not have a policy that specifically addresses red alert or plane crash at DIA.
If a plane is diverted into DIA with a sick patient, we send a code 10 ambulance to the airport for a diverted flight automatically. But according to this, we don't send even one code 10 ambulance automatically to a crash.
That is not the case in other large cities. In August 2005, when this Air France flight crashed in Toronto, the circumstances were very similar to the crash at DIA. The plane slid off the runway into a ravine and caught fire. Like the crash at DIA, everyone was able to get off the plane and survived. But unlike the crash at DIA, the first ambulance to this crash was on the scene in just 6 minutes. That's 27 minutes faster than Denver Health's response to Flight 1404.
The thing that you need most is ambulances, because no one is going to go off-site any other way but in an ambulance.
The mayor is probably going to need to sit down with those that are in charge of the EMS system and begin to look at what they need to do to develop a plan to improve it. If I was in that city, I would ask for an investigation.
The night of December 20th was not the first time ambulances needed more than 30 minutes to reach DIA, and not the first time Denver Health has been criticized for its ambulance response.